Medications like insulin for treating diabetes or other medications for arthritis, growth hormones, migraines, osteoporosis, erectile dysfunction, Crohn's disease, IVF, and many more require refrigeration to maintain their effectiveness and stability. These medications are often protein-based, making them highly sensitive to temperature changes. Whether you're a pharmacist or a patient, knowing how to store each medicine is essential to keep it effective. There's a lot of confusion regarding this important topic, and that's why today we'll investigate and find out precisely what medications require refrigeration and what do not. You will want to stick around until the end because this video will teach you everything you need to know about your medications and their storage requirements. And moreover, this video will help you understand how to keep your meds at proper temperatures, even in scenarios where you won't be able to properly store your medications. Let's get started. As we mentioned, many medications, including insulin, growth hormones, Ozempic, Mounjaro, eye drops, Humira, vaccines, and more require refrigeration. These types of medications, often referred to as biologicals, are temperature sensitive and degrade quickly when not stored properly. When exposed to temperatures outside their recommended range, their molecular structure can degrade, leading to a decrease in potency or the formation of harmful byproducts. Proper storage slows down these processes, ensuring the medication remains effective until its expiration date. This careful handling is crucial for patient safety and treatment efficacy, highlighting the importance of adhering to storage guidelines for these sensitive medications. Insulin storage. Insulin is an injectable medication used for the treatment of diabetes. It's a synthetic, human-like hormone that's very sensitive to temperature and light. All insulin, whether contained in vials, pens, cartridges, or other containers, must be refrigerated. For the next few seconds, we'll include a list of the most common fast-acting and long-acting insulins used in the USA. Their stability at room temperature outside of the fridge, but below 77 degrees Fahrenheit or 25 degrees Celsius, is limited to 28 days to 56 days maximum. Insulin can quickly go bad when not stored in the right conditions. Diabetes and weight loss injections. People with diabetes may be prescribed injectable medicines other than insulin to help lower their blood sugar levels. However, most of these medications are biologicals too, and they must be stored in a fridge to stay effective. There is a long list of diabetes and weight loss injections that require refrigeration. The list that you will see in the next few seconds includes some of these meds, but not all of them. Ear and eye drop medications. Most ear and eye drop medications must be stored in the fridge to stabilize their chemical structure, but they can stay at room temperature for a few days or weeks after opening, usually about a month maximum. Always check the specific storage instructions for each ear and eye medication before use. Common ear and eye drops that require refrigeration include glaucoma eye drops like latanoprost, Zalatan, Timolol, Vyzulta, chloramphenicol, and antibiotic eye ointment to treat bacterial infections like conjunctivitis, cyclopentolate, mainly used to dilate the eye before an examination, azocite, Lumigan, proparacaine ophthalmic solution, and many more, TNF inhibitors for inflammatory conditions. Some, but not all injectable medications used for the treatment of inflammatory diseases like rheumatoid arthritis, psoriatic arthritis, axial spondyloarthritis, ankylosing spondylitis, ulcerative colitis, polyarticular juvenile idiopathic arthritis, as well as certain inflammatory bowel conditions such as Crohn's disease, must be refrigerated too. Here are a few examples. Most of these medications are biologics based on an active ingredient that belongs to the tumor necrosis inhibitor class. They are made from living sources and do not tolerate high temperatures, freezing temperatures, temperature variation, or exposure to too much light. They must be kept refrigerated between 36 and 46 degrees Fahrenheit and can only stay at room temperature for a limited time without risking spoiling and losing efficiency. What about vaccines? Vaccines are probably the most temperature-sensitive cold chain medications. This is because they are inherently biological substances and contain living organisms from viruses and bacteria called antigens. Unfortunately, like any living thing you can think of, vaccines quickly spoil and go bad when exposed to high temperatures, and some can go bad when exposed to freezing temperatures. Most vaccines must be refrigerated and can only be left out of the fridge for very short periods of time, usually a few hours only. Migraine injectable medicines. Adults with severe chronic migraines can be prescribed injections classified as calcitonin gene-related peptide monoclonal antibodies, including 𝗪𝗡𝗥𝗟𝗗𝗪𝗡𝗚. All 3 migraine injectables must be kept refrigerated between 36 and 46 degrees Fahrenheit and can only stay at room temperature for a maximum of 7 days after first use. Asthma inhalers and injections. Diverse asthma medications also require refrigeration in order to stay effective for the longest possible, including biological subcutaneous injections, like Dupixent, must be refrigerated at 36 to 46 degrees Fahrenheit. Once out of the fridge, it must be used within 14 days. Xolair is a subcutaneous injection used to treat moderate to severe asthma, nasal polyps, and chronic spontaneous urticaria. It must be stored in the refrigerator and can only stay at room temperature for a maximum of 2 days. Fasenra is mainly prescribed to people with eosinophilic asthma and must be refrigerated or kept at room temperature for up to 14 days. Nucala is only stable at room temperature for 7 days. When it's not in use, it must be refrigerated. Most asthma inhalers and aerosol sprays, like albuterol or Ventolin, do not require refrigeration, but must be protected from high heat and kept in dry, cool places. Some more sensitive ones might need to be stored and transported at fridge temperature. Always read the instructions before use and transportation. Growth hormones medications. Growth hormones are biologics. They're extremely fragile and unstable products. All growth hormones must be stored and shipped refrigerated after reconstitution, and even a short rupture in the cold chain process can impact their potency. Common growth hormones in the USA will be shown in the next few seconds. Growth hormones are available in different forms, including lyophilized powder and vials, and 2-chamber cartridges for reconstitution, pre-filled cartridges, and pre-filled pens. Once reconstituted, they must be refrigerated and they can only stay out of the fridge for very short periods of time. We always advise you to read the storage instructions for each specific medicine. Antibiotics storage instructions. Some, but not all, antibiotics need to be refrigerated to prevent alteration of their chemical structures. Most liquid or reconstituted antibiotics have a short shelf life, but that doesn't necessarily mean they require refrigeration. When refrigeration is needed, the bottle or container usually clearly says refrigerate on it. Here are a few examples of common antibiotic storage recommendations. Amoxicillin does not require refrigeration even in its liquid form. However, it tastes better if refrigerated, and refrigeration won't harm the product. Penicillin oral solution must be stored in the fridge. Erythromycin suspensions may sometimes need to be refrigerated depending on the brand. Biaxin, Cleocin, and Bactrim liquid antibiotics are fine at room temperature. Augmentin must be kept refrigerated. Azithromycin should not be refrigerated. Whether refrigerated or not, most liquid or reconstituted antibiotics must be discarded within a few days or weeks after opening. Tablet antibiotics generally do not require refrigeration, but always check the specific instructions before use. Tablets and capsules. While most medication tablets and capsules can be stored at room temperature in cool, dry places, some are more unstable and require refrigeration, especially chemotherapy and antiretroviral medications. Leukerin tablets used for chemotherapy treatments of cancers must be refrigerated between 36 to 46 degrees Fahrenheit and are only stable for up to a week at room temperature. Liquid leukerin must never leave the fridge, even for a few hours. Etoposide capsules used to treat some forms of cancer must be stored under refrigeration. MCIT liquid capsules are used to treat some prostate cancers. Melphalan tablets, another chemotherapy drug used to treat certain forms of cancer, such as myeloma and ovarian cancer, must be refrigerated too. Lyotrix tablets used for treating hypothyroidism and thyroid disorders must be refrigerated. Norvir capsules, an antiretroviral medication used to treat HIV, must be stored in the fridge until dispensed. They may be kept at room temperature for up to 30 days. Caletra tablets, another antiretroviral medicine used to treat HIV-1 virus in adults, must be kept refrigerated. However, it's stable for 2 months at room temperature. Marinol capsules, made with cannabis delta-9 tetrahydrocannabinol and used to treat nausea and vomiting in patients undergoing chemotherapy, must be refrigerated or stored at a maximum of 59 degrees Fahrenheit. More temperature-sensitive medications. Additionally, the following medications require refrigeration too. This list of temperature-sensitive drugs is not meant to be exhaustive. Always read the storage instructions for each medicine before use, storage, or transportation. How can you store these medications safely if you're traveling or if you run into a power outage? Generally, medications that require refrigeration must be kept between 36 to 46 degrees Fahrenheit. But if you're planning to travel soon or you find yourself in a power outage, things can get a little tricky. Have you ever taken temperature-sensitive medications on a trip and wondered if storing them in your hotel fridge would be the best option? Maybe sometimes when you come back to your hotel room, you realize that the power was off from the moment you left your room, since you need to leave your hotel key card in the key slot and your medications have been kept at room temperature, which affects how and when you need to use your medications. Or have you ever found yourself in a situation where hotels don't even have a refrigerator? Yes, it's a nightmare, we know. However, for all the situations we mentioned above, we've come up with a great solution. The For All family coolers are here to keep your medications safe and effective, giving you the option to keep medications refrigerated from some hours, multiple days, or even 24/7. We have different products that we strongly believe will be the perfect solution to a hassle-free traveling experience. If you need one for yourself, you can visit the link provided in the description of this video. Remember that the appropriate storage of the contents of your medication has a significant impact on its efficacy and quality. That's it for today's video. We hope you have found this video helpful, and if so, please like, share, and subscribe for more healthcare tips. Remember, we're here to help you if you have any questions, so don't hesitate to leave a comment on this video. Until next time, stay cool and limitless.